Hi, mamas. Let's talk about chiropractic care for pregnancy. More specifically, how chiropractors can help you have the pregnancy, the birth, the labor, the postpartum recovery that you want and that you deserve. So, there are a couple things we look for as chiropractors when we are assessing a pregnant mama. First and foremost, we know that there are going to be a lot of physical changes as belly starts to grow. The whole center of gravity starts to shift forward, and the whole body has to compensate for that. A lot of mamas these days are spending a lot of time sitting down, sitting at the computer, and that changes the tension on the muscles, on the ligaments of your pelvis, and it can start to alter the shape and the balance of the pelvis. So it's really important to see a chiropractor that is trained in the Webster technique when you are pregnant. So what a Webster certified chiropractor is going to be assessing for is basically the balance of mom's pelvis and also nervous system overall. We want to make sure that the space through which baby needs to travel, this would be the pelvis right here, is as even and open as possible. If something is twisted or something is misaligned, it's going to tug and create some torsion on the ligaments that attach and suspend the uterus to the pelvis. It's going to create tension in the muscles. It's going to make it harder ultimately for the baby to find the best position during pregnancy and during labor and delivery. So the more ease we have, the more balance we have in mom's pelvis, the greater the experience for all who are involved. So a lot of what we're looking for with the Webster technique is the biomechanical balance of the bony structures, of the soft tissue structures of the pelvis. Now, there's also the global benefit to the nervous system, which is your brain-body connection during pregnancy and postpartum that chiropractic care is so important for. So think about the fact that your nerve system is essentially the way that your brain sends signals to every part of your body. Your brain is what controls your muscles. It's what controls even our automatic muscles like our uterus. So contractions are involuntary and they are being directly controlled by signaling in the nervous system. So we talk about having powerful, effective contractions during labor. It's really important that the nervous system is able to communicate openly to make sure that that power supply to mama's pelvis is firing on all cylinders. Another thing to consider is the stress response in general. During pregnancy and during labor, we know it's important for mom to be in as relaxed and as open of a state as possible. You want to be in this rest and digest, we call it the parasympathetic nervous system state. That's going to contribute to opening, to softening. It's going to help things in labor progress. What we don't want is that fight or flight, that survival mode. It's going to cause everything to constrict and to lock up and to close up. No good for mom and no good for baby. So chiropractic care is so great at helping to balance the nervous system, to activate that parasympathetic, to really facilitate a healthy stress response so that things can be as optimal as really our bodies were designed to be during labor, delivery, and recovery postpartum. So let's touch on recovery postpartum. We just talked about all the changes that happen in the body when the pelvis is coming apart and making space for baby. After delivery, everything has to come back together. So our job as chiropractors then becomes making sure that things are balanced and in alignment so you can heal as optimally as possible. Self-care is not selfish. What you experience as a mom throughout pregnancy, labor, delivery, and beyond, baby feels you are one. And it's really important, mamas, to take care of yourself because it is important. You are the glue that holds everything together. And we absolutely love helping pregnant moms. If you have any questions about chiropractic care during pregnancy, please reach out. Our assessment for pregnant moms is so super gentle. We have a way of measuring stress and imbalance in the brain-body connection in the nervous system using digital scans that do not involve any radiation. They're totally safe for mom and for baby, and they're super effective in helping us identify exactly what areas need to be balanced. So if you have any questions, please reach out to our office. We would love to help.